Hi, I'm Dr. John Van Wagoner. I wanted to talk a little bit about allergy shots and how they work and the benefit they have for patients. Allergy shots are a method that we use as allergists to give people an immunization against what they're allergic to. Now, these immunization shots that are administered in our office are based upon what an individual is allergic to. We find out what a patient is allergic to by one of two methods. We can either use a skin test that is a safe, easy, FDA-approved device in our office that allows us to skin test you in a pretty rapid fashion with really timely results to different things that may be in your environment. For instance, we may test you to common trees in the area, common grasses, common weeds, common molds, cat, dog, dust mite, cockroach. Those are some common things that people are allergic to that gives patients symptoms like allergic rhinitis or hay fever or allergic asthma. Sometimes those pollens can also trigger eczema. There are certain situations where we may need to test someone to fire ant or other stinging insects like bees and wasps and hornets, and we can skin test to those things as well. The other way that we can test patients would be via a blood test. Now, in our office we don't draw blood, so we typically will order a lab that you can get drawn at the lab, and that test is equally reliable as a skin test, and it can identify what it is that you're allergic to. Now, once we figure out what you're allergic to based on either a skin test from my office or a blood test, immunocap test from the lab, we can, in our office, put together a combination of what it is that you're allergic to, if there are multiple things that you're allergic to, and put those into a vaccine that we give the patient over time. Now, typically, allergy shots are not a one-shot therapy or cure for patients that have allergies or asthma or stinging insect allergy. Unfortunately, the allergy shots have to be given over months to sometimes years in order to invoke permanent to long-lasting results. Now, the benefit of allergy shots include the following. Typically, they can help reduce the need for medications. They can help reduce the need for oral steroids. They can help reduce the frequency of secondary bacterial infections. They can help reduce the severity of allergies. They can help one's eczema. They can help ones that may have stinging insect allergy. So there's a lot of variety of different ways these allergy shots benefit patients. Now, the blessing about allergy shots is that typically within a couple of months of administering the allergy shots, patients should be better. And so we'll track patients every 3 or 4 months on allergy shots and see how they're doing. And at timely intervals, we may choose to reduce medications that you're currently on that are also needed while you're on the allergy shots. Our goal with allergy shots is to improve your quality of life. They are an easy, relatively safe method of vaccinating one to what you're allergic to. There are risks involved with allergy shots, and I think it's prudent that we go over those things. 99.99% of the time when we give an allergy shot, no adverse reaction occurs in our office. To some degree, some patients do get local reactions on their arms at the place where they do get the allergy shot. And in my opinion, those are expected secondary events from doing the allergy shots, and they don't induce or they don't put you at risk of having something systemic or anaphylactic occur. But we are very sensitive to those types of local reactions, and we'll work with our patients to help them work through that and use different methods to lessen the severity and the duration of those local reactions. Now, very rarely there's some other types of reactions that may take place with the administration of allergy shots. The majority of these reactions, if they're going to take place, will occur almost immediately after the administration of the allergy shot. Thus, that's why we make everybody in our office who receives an allergy shot waits 20 minutes after they receive their allergy shot. That 20-minute window gives us at least a holding pattern for us to administer or watch you while you receive your allergy shot and make sure nothing happens. The more moderate to severe reactions that could occur that I have seen with the administration of allergy shots includes the following: laryngospasm, or kind of spasming or closure of the throat, to the development of hives on the body or rashes, to the development of nausea, vomiting, coughing, stuffy nose, headache, itchy red, watery eyes, sometimes uterine cramping. I've seen loss or reduction of blood pressure, passing out, and in very, very rare circumstances, death has been reported in case reports in people that have received allergy shots. I've never seen the latter type of problem, but it is described. That's why it's very important that all my allergy shot patients are required to have a dose of what we call epinephrine or adrenaline. This is a pen of an emergency medicine that you can administer yourself if you had left my office and started having one of these systemic severe reactions. Now we have that drug also in our office and can give it to patients who are having an adverse reaction to the allergy shot. It's very, very rare that that occurs. It's very, very rare that patients have to use that epinephrine or EpiPen outside of my office. But it is one of those safety mechanisms that we require everyone to have, and I just want to make sure that everybody's safe when they get allergy shots, and at least if they did have a reaction, they have a medicine to give themselves to reverse the reaction, or at least buy you time to be seen by other medical personnel. In general, allergy shots are a wonderful way we can use the technology and the medical knowledge that we have to help people feel better. It's one of the best things we offer from our office. If you're interested in doing allergy shots, I welcome you to make an appointment with our office and we can talk about testing and the benefits of allergy shots that may apply to you. Thank you for listening to this conversation.